That's right. It just essentially sounds like it's made things worse, Keenan. Now, over at the Detroit Recovery Project, we're learning that they're not only seeing an uptick in new users, drug users, that is, but also those who are in long-term recovery, 10 to 15 years of hard work, of recovery, that they have also relapsed, as well as some of them have lost their lives.
It's almost like a twofold pandemic. Opioid addiction and addiction itself has always been a pandemic.
Andre Johnson says the pandemic's pulled no punches for those struggling with drug and alcohol addiction and recovery. It's a struggle he knew firsthand and helps others while serving as CEO of the Detroit Recovery Project.
The pandemic has created this isolation, this lack of socialization, and those are the variables that helps people to stay drug and alcohol free.
He says social connection is key to recovery. New data from the Michigan Department of Health and Human Services shows from January to June of 2020, there were 1,340 overdose deaths in our state. That's up from 1,155 in that same time frame in 2019, a 16% increase. Also, opioid-related overdose deaths increased by 20% in the same time frame, from 874 in the first half of 2019 to 1,045 in the first half of 2020. The state says the deaths are likely underreported.
Almost every day we're deploying Narcan to try to save a life.
Oakland County Sheriff Mike Bouchard says opioid overdoses have grown steadily since the life-saving Narcan drug was deployed by the department in 2015, used by deputies to stabilize people who've overdosed.
At this point, we're close to 400 times just at the sheriff's office.
He says there's much higher trafficking at the southern border, with fentanyl smuggling up 43% in the previous month or so, as well as importation of synthetic fentanyl from China. More supply, lower prices, more buying.
And the other thing we're seeing too is a big increase as it relates to meth and ecstasy. So, you know, we've got a lot of different things happening simultaneously. More drugs coming in, higher potency of those drugs, and then couple that with obviously what my grandma used to call cabin fever.
Again, quarantining from the pandemic exacerbating an already prevalent problem, anxiety and depression leading to self-medication, he says. One solution, Bouchard says, is to secure the border.
Number two, create a process that's easy for a person to get treatment, to get help.
Now, when people are saved by law enforcement, with the use of Narcan, they are not charged criminally. However, they are treated at the hospital. Now, the sheriff there, Bouchard, says that he would like to get those individuals help, but because of health privacy laws, he's not able to give their information up to community health, and so it's cyclical. Law enforcement ends up seeing repeat users. So, reporting live, Darren Cunningham, 7 Action News.
All right.